So Dr. Fursley here, back to our educational series. This segment and future segments are going to be talking about brow lifts. So our last segment was talking about blepharoplasty, removing eyelid skin. And now we're going to be talking about the brows, and it's good that we introduce blepharoplasty first. So during the consult from the other videos, we have to determine, is it an upper eyelid skin issue? Or is it that the brows have descended and become heavy, causing that upper eyelid skin issue? Or is it both? So that's what we would determine during your consult. And here we're going to be discussing the brows alone. So if the brows have descended, which are going to cause that hooding effect, and also over time, you're going to get creases in your forehead and you're going to get creases in this frown area. Those all have to go into when planning to execute to determine if you're a candidate for a brow lift. So in this diagram, which you're going to be seeing in this video and the ones to come, we're pointing at the relevant anatomy. So you see the brows have descended, you see the tired look, you see that hooding, and you're also seeing run across the forehead and the frown area creases. And depending on what and your anatomy and the way you've aged is how we determine what type of brow lift technique would be best suited for you. So that again depends on your anatomy, how you've aged, where the brows are. Are both brows the same? Is one more descended than the other? Do you have a lot of forehead creases? What's your gender, male versus female? That also determines what the best technique is. And also really important is, where does your hairline lie? Do you have a high hairline? Do you have a low hairline? The size of the forehead. So we're going to be chatting about all these things in this video and the upcoming videos to come. And then lastly, just to touch on this picture, we see a lot of kind of anatomy. Here we're pointing out structures that we're looking for during the surgery, such as important veins, important arteries, important nerves that we need to identify and preserve during brow lift surgery. So stay tuned for the next couple of videos to go through each technique. Thanks.